These are really testing times, and for now, entire healthcare resources are directed towards arresting this pandemic and reduce the suffering of those who have been hit by it. But there are others suffering from chronic illnesses, awaiting their surgeries which have been planned at least a month in advance. And soon, you, me, and our hospitals needs to open their doors and welcome them. But while we do so, we have to be sure that the safest possible way are done. Hi, I am Dr. Neeraj, a consultant intensivist at Sir Gangaram Hospital, New Delhi. Coming Saturday, that is 2nd May, at 6 p.m., we shall discuss what are the ways in which we can do so. I would like to thank VHP Life Sciences and DocMed which are making this webinar possible. So I welcome you all to join me on this Saturday at 6 p.m.
Hi friends, this is Amit Patki, Medical Director at Fertility Associates, Mumbai, and your Vice President at ISAR. We all are going through this severe pandemic, but I'm sure we all are stressed. But this is a time for us to introspect, to reflect, and to decide how we are going to lead our life in the future. I don't know when this pandemic and this lockdown will be called off, but we need to prepare ourselves, our staff, and our patients on how we are going to treat them during the pandemic and post the lockdown period. But don't despair. I think this is a time we can use to have a lot of fun activities with the family. This is a time that we can educate ourselves. And this is the time that we can do all the things that we wanted to do but didn't have the time to do it. So tune in on 2nd of May, Saturday at 6 o'clock, when I will take you through how to counsel the infertile couple during the pandemic and post the lockdown. At 6 o'clock, 2nd of May.